Okay, here we go again. I am speaking right now, so if you don't hear me, please send a message, and I'll be starting in a minute or two. The connection is shaky, but it's operational. At times during the live broadcast, I shall be stopping because YouTube is warning me that my connection is unstable. So it's not me going mute or forgetting what I have to say because of my ongoing Alzheimer's. It's just that YouTube tells me to shut up. Okay. Today we're talking about Turkey lifting coronavirus restrictions in a month. I am made to understand by people who guided me into this YouTube broadcasting night that YouTube doesn't appreciate the word corona, COVID, or anything related because there is dissemination of a lot of false information, with which I agree. So by normal, I mean relaxing the restrictions imposed because of the coronavirus outbreak in Turkey. Wow, wow, life changed suddenly. And the broadcast shall be composed of three parts. First, where are we in the outbreak? Two, what are President Erdogan's plans for normalization? And three, are these steps correct, judged by the medical profession and my understanding of best international practice? I'll tell you right away, they aren't. We're going about this in a very roundabout way. And if we are incorrect in our estimation of the extent of the outbreak, the price to be paid would be a second wave. I am starting in 1 minute. I am gonna say this more loudly. Yeah, I am a stickler for punctuality. I am sorry. I can't start early or late. And I want to thank everyone. You're coming from different time zones, and I really appreciate you sparing 20-25 minutes for my mumblings here. And please do share if you like. I personally don't care if you subscribe or not. That's your problem. But if you know anyone who's interested in Turkey academically or business-wise, do share. Okay, it is 2 p.m. Istanbul time. You are at Real Turkey channel in YouTube, and I'm Atilla Yeşilada. So far, your only host, but hopefully, if Mr. Erdogan's plans go right, within a month, by the religious holiday Eid, some or many of the coronavirus-related restrictions will be lifted, and people like me who are 60 shall be able to travel, talk to others, and this broadcast will be livelier, more participatory, and more interactive. The title of this broadcast is "Why Are We in Such a Rush to Return to Normal?" At this point, Turkish cases are still 2,000 per day. Our death count is pretty low, but to be perfectly honest with you, I don't pay much attention to the death count. Obviously, it's a human tragedy. Every person who dies leaves a scar in my heart. But you should read Financial Times, which has done its own study. Death counts are wrong in every country. That's because the medical community is too busy saving people rather than, filing paperwork. But the case count, in my view, while I have no view on that because I am an economist and a bad one. But in my understanding of what the medical profession is saying is an underestimate, and there is no comprehensive study of the prevalence of the virus in Turkey. Therefore, we have to be extremely careful and go very gradually, go very cautiously in terms of relaxing social restrictions, social distancing measures, the weekend lockdowns, and opening shopping centers. And at each step, we should evaluate the impact of these measures on the case count and then move on one step further. Now, let me first start why, obviously, not the entire medical community, but a majority believes that the outbreak is not yet under control. First of all, the health ministry doesn't share detailed data. So the medical profession has no way of replicating the health minister's claim that the outbreak has peaked and is currently in a descent. As you know, in science, replicability of an experiment is of critical importance. You may make a claim backed by an experiment, but if another university can't replicate that experiment, it just doesn't stand in the scientific community. We don't know what R0 is. I mean, R0 is coefficient of the virus. R0 above 1 means each patient, whether symptomatic or asymptomatic, spreads the disease to more than one person, which means over some time, the number of the patients will increase. First, logarithmically, and then at some point, exponentially. We don't know what that number is. If you look at countries which had great success in dealing with this, such as Germany, South Korea, what they do is national random testing to understand just how prevalent the virus is in the population. Some of these people show no symptoms whatsoever, but they are still contagious to others. We need to know whether these people are clustered somewhere, what their percentage is in the population, and how much of a threat they present, whether they're overrepresented in certain population groups. We are going to normal without undertaking such a study. All the testing in Turkey is passive. We do 40,000 tests, which is excellent. I think it's one of the highest numbers divided by population among developing nations. But you get tested if you go to a hospital or healthcare center, with complaints, or if someone, if you have contacted someone who has been diagnosed with the virus. There is also active testing, which is identifying high-risk groups, which in Turkey would be anyone who lives in the provinces bordering on Iran, where the outbreak is still raging, Iraq, where it is still taking off, Syria, where no one knows what's going on, but I suspect there's a massive outbreak there, as well as the Syrian refugees numbering 4 million. We have no information on how many of them are infected by the virus. The prisons, we have no information on prisons. Moreover, I have read the statements by at least 5 medical professors, doctors and medical professors, 3 of whom serve on the National Science and Advisory Committees, who said at this point they cannot confirm that the outbreak is declining. And they're not advising against relaxing social measures, but they're advising to go about it in an extremely careful way. All this being said, I could still understand or sympathize with Mr. Erdogan's decision to start relaxing social restrictions. But again, based on international practice, he is doing it the right way. For instance, although it's not an official announcement, the shopping centers are preparing to open by mid-May. And that's the worst thing you can do. I mean, there is no way you can preserve social distancing measures in shopping centers. It just doesn't work that way. We're opening all of our factories and workshops, which is the most unsanitary places in Turkey, as in most developing markets. No matter how hard you try, in a textile factory, there is no way you can maintain social distance. It just doesn't work that way. We're opening our tourism facilities for domestic tourism. How are you gonna preserve social distancing when you have dances and you know activities every night? I really don't understand it. For instance, what Germany does is they only allow small shops to open and go very careful with factories. Some countries start with primary schools because apparently the children are the least affected age group by the coronavirus. No one is talking about opening mass facilities. So there seems to be two problems here. A, we are acting rash in the sense that we are not certain whether the outbreak is under control. B, even if it is, we're doing it the wrong way as judged by international experience. Why? I think the main reasons are political and economical. Politically, I have four polls, one of which comes from March or early March, which shows Mr. Erdogan gaining popularity, and three polls, which shows his leadership hasn't really helped him to make any points with the constituency. That, you know, he hasn't really gained any votes from this crisis. On the other hand, concerns about the economic outlook and unemployment are extremely high. And obviously, if you keep the economy locked down, these concerns will increase and could reflect poorly on Mr. Erdogan's electoral chances. Some of his voters and his Congress people could migrate to rival parties. There's another allegation which partly shows in polls that AKP is losing the battle to provide services to the people in the cities, to municipalities run by CHP mayors, such as Mr. Ekrem İmamoğlu in Izmir, Mr. Mansur Yavaş in Ankara, Mr. Zeydan Karalar in Adana, that these people have been, despite the obstacles thrown in their way by the government, these people have been very effective in terms of delivering much needed food, sometimes even money and jobs to the poor neighborhoods. And remember, AKP has built its power on these patronage networks, that it has delivered steady and consistent aid to poor people who live at the edges of the cities. And in return, they pledge their votes to AKP. It appeared that CHP mayors are stealing the show. And the sooner you end these quarantines and restrictions and people can't find their jobs, the better it is. These may be the political reasons. Economic reasons are more important, I think. There's a lot of misunderstanding, I'm sorry, about the difference between how developed countries and developing nations can deal with the economic impact of this crisis. I mean, Fed prints endless amounts of money. The American government can unveil support packages or aid packages running into trillions of dollars. That's because Fed prints dollars, accept and keep in their portfolios. And there is very little, if any, doubt that the American government will make good on its debt. The same thing goes through for Germany, UK, etc., etc. These are triple or double A rated countries, and their monies are called reserve monies or global monies. Turkey, Brazil, South Africa, India, Russia are not countries like that. Emulate the same methods. That is, we may spend as much as we want to through the budget, but when it comes to borrowing, we're not as free as the American or German governments. People don't lend to us after a certain limit, thinking we will not be able to pay. Our banking systems are much smaller. So we need to borrow abroad, and foreign investors obviously want to know a solid balance sheet. The central banks can print money, but remember Gresham's law: bad money chases good money away, which means if you have too much TL and not enough euros and dollars, people will buy dollars and euros and use TLs. And that's what's exactly happening in Turkey. The money printing, in as much as the government tries to control it, is seeping into the currency market, leading to depreciation of the Turkish lira, which has bad consequences. More importantly, as long as the dollar is strong, no matter what you do at home, doesn't ease financial conditions. That means part of the monetary and fiscal easing undertaken by the governments and monetary authorities in developing nations is undone by a strong dollar. And Turkey is a prime example of that, simply because we have corporates who carry a huge amount of FX debt. And in fact, if you follow Turkey, you may have read comments that Turkey is running. Authorities said a few things about that, but these articles appeared in Financial Times, Bloomberg, Reuters. You can check the Google and find. So I think one reason why Mr. Erdogan is in such a haste to reopen the economy is to generate revenue for the budget as soon as possible, to end payments from the budget to unemployed and to those companies who had to shut down because of the lockdowns, which would reduce the budget deficit and allow Turkey to borrow more, and to slow down the money printing to reduce the pressure on the currency. These are understandable, but unfortunately, the risks are too high. I follow Iran closely, which was also forced to end some restrictions on small businesses, and it has still not dealt successfully with the coronavirus. In fact, one of the authorities from the regime has said he's mindful of a second wave, a second outbreak. Data from Iran is ambivalent. I mean, the government says 5,000 dead. I'm sorry. You look at opposition, they say 40,000 dead. I really don't know what the truth is, but probably it's somewhere. America is another test case. I mean, the Republicans, most of them, obviously, I don't want to categorize, they want to go back to work. They don't think the virus presents a huge threat, in particular, right before summer. Most of the Democrats are more cautious. I listened to Dr. who turned out to be Brad Pitt. I didn't understand that. Are they the same persons? Just joking. To Dr. Fauci, who thinks that America ought to be very cautious. And, if you go too fast in these matters, you may start a second outbreak, which not only causes a double dip recession, but it also devastates morale. There is nothing more damaging than your leader telling you the threat is over. You can now come out of your bunkers. All is safe. And then 5 days later, there is another lockdown. That destroys your morale. And that's what I'm afraid of. I hope none of this happens. Maybe the virus really goes into dormancy over the summer months, or Lysol helps it. I want to thank American President Trump, by the way. I use Lysol internally and externally, and it has kept me alive. I am, hoping that he will give me more solid medical advice like that every day, so I can live healthily throughout this medical malaise. Anyhow, it's my personal opinion, obviously, that June is going to be a fateful month for Turkey and Mr. Erdogan. He is taking a big bet, a big gamble on the health minister's advice that the coronavirus outbreak is about to be over, and there are acceptable risks in terms of ending social restrictions and opening up the economy. If he is correct, then there will be some amount of economic recovery. I don't know enough to save the Turkish lira, but at least he will be able to remain in power. If he is wrong, if Turkey suddenly starts reporting a rising case number and lockdowns will have to be repeated, I don't think even Erdogan's incredible charisma can handle that shock, and Turkey may be headed for political stability and early elections, not to mention a balance of payment crisis, that is a run on the Turkish lira, which leads to rapid double-digit depreciation. These are the risks. We have reached the Rubicon, and we don't know whether we should pass it, cross it or not, or what lies on the other side. Thank you very much for watching me and listening to me. Hopefully in a few days we'll be together once again. And to me, no matter what your leaders say, listen to Dr. Fauci. He seems to know what he's talking about. Stay well, stay healthy, stay home. Bye-bye.